Welcome to today's class. I'll be speaking about Kennedy's classification of edentulous arches and Applegate's rules. I'm Dr. Kevin Fernandes, Reader, Department of Prosthodontics, Yenepoya Dental College. Coming to the specific learning objective, at the end of the session, I hope the student will be able to understand about the requirement of the classification, various classification systems, and will also be able to identify various partially edentulous situations. The set induction for this topic is the importance of identification and communication. Coming to classification of partially edentulous ridges. Why do we need to classify this? The need for classification is basically to formulate a good treatment plan, anticipate the difficulties commonly to occur for that particular design, to communicate with the professional about a case, and for ease of communication between the dentist and the lab personnel. What are the basic requirements of an acceptable method of classification? One is to allow visualization of the type of partially edentulous arch, permit immediate differentiation between the tooth supported and the tooth and tissue supported removable partial denture. It should be universally accepted and also a guide to the type of design to be used. There are various classifications given, but today I'm going to specifically speak about Kennedy's classification. So Kennedy's classification was given in 1925 by Dr. Edward Kennedy from New York. He formulated this system which is based on the relationship of the edentulous spaces to the abutment teeth. It's a positional or an anatomical classification. The Kennedy's classification system is composed of 4 major categories. The classification system was based on the frequency of occurrence, with class 1 arches being most common and class 4 arches being least common. So coming to what is Kennedy's class 1 arch? A bilateral edentulous area located posterior to the remaining natural teeth. So as you can see, there's loss of teeth on both sides, which is bilateral in nature. Coming to what is Kennedy's class 2, it's a unilateral edentulous area located posterior to the remaining natural teeth. Coming to Kennedy's class 3, once again a unilateral edentulous area with natural teeth here present both anterior as well as posterior to it. Coming to Kennedy's class 4, it's a single bilateral edentulous area located anterior to the remaining natural teeth and also crossing the midline. Now Applegate made certain specific rules for this classification. While the Kennedy system provided a method for classification of partially edentulous arches, there was some uncertainty regarding its application. So in 1954, Dr. O.C. Applegate provided the following rules to govern the application of the Kennedy system. So once he brought in the rules, 2 additional classes were added, that is class 5, basically meant teeth bound the edentulous area anteriorly and posteriorly, but the anterior bounding tooth is not suitable as an abutment. Or basically what it meant was it was not strong enough to be used as a direct retainer. As in here, this case, you can see the lateral incisor. So it is basically a class 3 situation where the anterior abutment cannot be used for any support. Coming to class 6, it's an edentulous situation in which the boundary teeth are capable of total support of the prosthesis. This situation hardly requires any any tissue support. The abutments are capable of providing total support here. Coming to Applegate's rules, he formulated 8 rules. So we start with rule number 1. He said that the classification should follow rather than precede any extractions of teeth that might alter the original classification. So basically, before we classify the arch, we need to extract all the abutments which are not favorable for support. Rule number 2, if a third molar is missing and we do not replace it, it is not considered in the classification. Coming to rule number 3, if a third molar is present and it's to be used as an abutment, it is considered in the classification, as you can see. So if the second molar is missing and not to be replaced, it is not considered in the classification. That's what states rule number 4. Rule number 5 states that the most posterior edentulous areas always determines the classification. Rule number 6 says that the edentulous areas other than those determining the classification are referred to as modification spaces and are designated by their number. So as you can see here, this is going to determine the classification. So as there are teeth anterior and posterior to it, it becomes a class 3, and we have 3 edentulous spaces, 1, 2 and 3. So basically this becomes a class 3 modification 3. Coming to rule number 7, the extent of the modification is not considered, only the number of additional edentulous areas, and it is denoted by a number. So we don't worry about how big the edentulous area is. All the additional edentulous spaces are denoted by a number. Coming to rule number 8, there can be no modification areas in class 4 arches, as the edentulous area lying posterior to the single bilateral area determines the classification. So basically, as rule number 5 stated, that the posterior most edentulous space determines the classification, therefore there can be no modifications in class 4 arches. To summarize, let's classify some edentulous arches now. So in this situation, as you can see, you have a single edentulous area. So basically it becomes a class 2 modification 2. So as you can see, there are 2 additional edentulous areas, so they'll be denoted by a number. So basically it says this is a class 2 mod 2. Coming to another situation, this is a classic class 2 situation, and the reason is that it isn't crossing the midline and it's a unilateral edentulous area. And as you can see, this is a class 3 mod 1 situation. So one edentulous space will determine the classification. So it says it's class 3, that you can see that there are teeth anterior and posterior to it, and the other edentulous place will be denoted by a number. Therefore it is class 3 mod 1. These are my references. Thank you.